joint inspection of services for children and young people at risk of harm in Glasgow City. All children and young people have the right to feel loved, have the care they need to grow and develop, and be protected from being harmed. We wanted to understand how well services are supporting children, young people and their families who need extra help from people including teachers, health visitors, nurses, doctors, family support workers, social workers or others. We sent surveys out to children and young people and parents and carers. We received 144 from children and young people and 67 from parents and carers. We also sent out a survey to staff and received 1,301 responses. We read records belonging to 120 children and young people. We read information about Glasgow City that is available on the internet. We looked at written records and reports that Glasgow City shared with us. We met with staff, managers and senior leaders. Here are some of the things that we found were working well for children and young people in Glasgow City. Local organisations, schools, health and social work services were providing lots of different types of help for families facing poverty. This helped make children's lives better and safer. Family support services helped lots of families get the practical and emotional help they needed. Importantly, Glasgow leaders had provided long-term funding for the organisations delivering these services. Most children and young people had trusting and positive relationships with staff. This helped to keep them safe and get support when they needed it. Most children and young people felt listened to, heard and included by the staff involved in their lives. Leaders had a clear vision for services. They had to make some difficult decisions about money, but they made sure that helping children and families was a priority. Here are some of the things that services in Glasgow City need to do better. Some families found it hard to get the help they needed at the right time, especially if they needed mental health support. Some local services had closed or had long waiting lists. Interpreter support and independent advocacy was not always easily available to children and young people. Despite staff working well together, at times it was very challenging to improve the safety of young people who were at risk of harm in their communities. Housing pressures, poverty and deprivation continued to impact children's well-being. Glasgow services alone did not have the resources needed to fully address these issues. Overall, we found that services in Glasgow City were having a good impact on children and young people who needed help to stay safe. Although there were some things they could do better, services had helped lots of children, young people and their families to get the help they needed. Thank you to all the children and young people who spoke to us during our inspection and completed our surveys. Our full inspection report can be found at careinspectorate.com. Follow us on Facebook, Instagram and X.